Feeling frustrated with hip pain? Don't know what is causing it or how to fix it? Many people experience hip pain at some point in their life. It's a condition that can be caused by a variety of issues. Knowing where your pain is coming from can give you clues to its cause. For example, pain on the inside of your hip or groin is likely a problem within your hip joint. On the other hand, pain on the outside of your hip, your upper thigh, or your outer buttocks is probably an issue with the muscles around your hip joint. In some cases, your hip pain might even be originating in another part of your body, like your lower back. So before doing anything to relieve your pain, make sure to identify if your pain is primarily coming from the thigh, groin, buttocks, and if it's inside or outside the hip joint. What is the hip's main function? The hips are the single largest support structure in the body, as they hold the entire torso upright. They are located where the femur meets the pelvic socket. The hip joint is similar to other joints in that it is surrounded by protective cartilage. If this cartilage becomes worn down, such as with age, or suffers a direct injury, pain can occur in the hip. The hip also connects the lower extremities with the axial skeleton. It allows for movement in 3 major axes, all of which are perpendicular to one another. It can also withstand repeated motion and a fair amount of wear and tear. Despite its durability, the hip joint isn't indestructible. With age and use, the cartilage can wear down or become damaged. Muscles and tendons in the hip can get overused. Bones in the hip can break during a fall or other injury. Any of these conditions can lead to hip pain. If your hips are sore, here is a rundown of what might be causing your discomfort and how to get hip pain relief. What causes hip pain? Hip pain can be caused by 1. Muscle or tendon strain. Repeated activities can put a strain on the muscles, tendons, and ligaments that support the hips. When they become inflamed due to overuse, they can cause pain and prevent the hip from working normally. 2. Hip fractures. With age, the bones can become weak and brittle. Weakened bones are more likely to break during a fall. 3. Tendinitis. Tendons are the thick bands of tissue that attach bones to muscles. Tendinitis is inflammation or irritation of the tendons. It's usually caused by repetitive stress from overuse. There are many different treatment options for hip pain that include conservative measures like pain relievers and home remedies, specialty services such as chiropractic care, physical therapy, acupuncture, and more invasive procedures like injections and surgery. What are the best ways to relieve hip pain? 1. Strength exercises are key to relieving hip pain. A few examples are A. Knee lifts. B. External hip rotation. C. Hip flexion. D. Hip extension. E. Hip abduction. Although these exercises may result in temporary discomfort, they should not cause or aggravate pain. If an exercise causes pain, stop doing it or try going at a slower or gentler pace. People who have recently had a hip replacement should consult a doctor or physical therapist before performing any of the exercises. 2. Rest. Avoid doing things that require you to bend at the hip or put a lot of pressure on the hip. Avoid sleeping on the side of your hip that is painful and sitting for long periods of time. 3. Cold and heat. Treating pain with heat and cold may help. Wrap an ice pack on a bag to ice your hip. A warm bath or shower may also help reduce your pain and prepare your muscles for stretching. 4. Stretch. Gently stretching your body may reduce hip pain, especially if the cause is a strain or pinched nerve. 5. Supplements and herbs. Certain dietary supplements can help support healthy cartilage cells to protect the hip joint from wear and tear. Glucosamine and chondroitin can help repair damaged cartilage in the hip joint and prevent enzymes from breaking down cartilage further. Vitamin D3 is also important for maintaining good bone health and supporting immune system functioning to decrease inflammation throughout the body. Certain herbs are thought to play a role in promoting a healthy immune system and reducing inflammation, including licorice, ginseng, cat's claw, and echinacea. Make sure to always talk to your doctor before taking any supplements. Final thoughts. Prevention is key for avoiding hip pain and possible complications that may require surgery. Getting enough sleep, eating healthy, and staying active and exercising can help lower levels of inflammation to reduce the risk of injury and hip pain. Don't wait. Start taking care of your hips.